Condom Connection is the largest non-profit sexual health organization in Canada, with 60 clinics in British Columbia. Our mandate is to provide comprehensive sexual health education, accurate information, support for reproductive choice, and access to confidential clinical services for students. For this project, Condom Connection aims to serve 18 to 24-year-old public post-secondary students across the Lower Mainland.
Sexually transmitted infections, or STIs as they are commonly known, are a growing concern amongst young adults in Canada. According to the BC Centre for Disease Control, in 2015, BC saw its highest rates of chlamydia, the most commonly reported STI in the province, in females aged 15 to 24 and males aged 20 to 29. Unfortunately, STIs can lead to a host of poor health outcomes, including but not limited to infertility or stillbirth, increased risk of cervical cancer, and pelvic inflammatory disease in women. STIs are especially prevalent among university students because not only is the university campus a very social environment in which students may choose to explore their sexuality, students also face peer pressure, reduced supervision, and two major barriers to safe sex practices. There is often not an available supply of condoms for students, and students also tend to avoid purchasing or obtaining condoms because they fear being judged by their peers. They will risk having unsafe sex if it means avoiding feelings of embarrassment, shame, or anxiety.
We are planning to implement this program to raise awareness of the risks and consequences of STIs and promote safer sex practices in post-secondary students across the Lower Mainland. We have 3 program objectives that we hope to achieve by the end of the 2-year period. The first objective states that the number of students who report increased knowledge of STIs and methods of prevention will have doubled. With our second objective, we hope condom carrying among sexually active students will have increased by 30%. Lastly, we want the number of sexually active students who report using a condom during the last 3 occasions of sexual intercourse to have increased by 30%.
The Condom Connection team will be present at all 11 public post-secondary institutions in the Lower Mainland. We will have information booths at school fairs and events at the beginning and throughout the fall and spring semester, starting in fall 2018 for 2 years until 2020. Students will be able to get information from our trained volunteer specialists, get involved in the conversation about safe sex, learn about sexually transmitted infections and sexual health. Our booths will also provide students with information pamphlets pertaining to sexual health. Another goal for this project is to increase the use of condoms in the post-secondary community. Therefore, our ongoing project component will be the condom dispensers that will be installed inside male and female washroom stalls. They will be installed based on the number of students enrolled in each institution. There will be approximately 2 dispensers per 5,000 students. The students will be able to purchase condoms at a low rate of 25 cents in privacy to help reduce any possible stigma.
Our booths will include anonymous surveys for students to complete on iPads. The information from these surveys throughout our project will give us an idea of the progress we have made and give us the chance to adjust our activities as needed. To see whether our 3 objectives have been met by the end of our project, we will compare results from our initial baseline survey to that of our final survey. Our statistics co-op students will be responsible for analyzing data throughout the project. They will be working closely with BC Centre for Disease Control and the regional health authorities to obtain information about STI rates and trends over our 2-year time frame. The revenue made from the condom dispensers will be recycled back to buy more condoms to refill dispensers. Furthermore, to carry out our project, we will have support from multiple partners including the BC Ministry of Health, BC Centre for Disease Control, Fraser Health, and Vancouver Coastal Health.